Greetings and welcome to the latest edition of Modern Healthcare's The Checkup. I'm Jeffrey Young, News Enterprise Editor. I'll be joined today by Brian Smith, who's the president and COO of Secours Mercy Health, based in Cincinnati. After a merger in 2018, it became one of the largest Catholic health systems in America, with 50 hospitals and 3,000 providers in 7 states, including its home state of Ohio. Obviously, with the surge in COVID driven by the Delta variant, we'll be talking about how his health system is dealing with the many challenges facing itself, its patients, and the community it's in. But regular business also still has to go on, and we also have to think about the future. So with that, I want to welcome Mr. Smith. Thank you very much for being with us today.
Well, thank you for having me. Looking forward to our conversation today.
So I'll start out with the obvious. How are you managing, and how is it varying in the states where you operate in terms of the volume of COVID patients, the severity, and all those things?
Yeah, so obviously timing's everything. So 2 weeks ago, if we're having this conversation, it's a little bit different answer than where we're at today. And so as we operate in multiple states across the East Coast, as well as in Ireland, it's really a tale of 2 countries. Ireland's doing great. Our organizations here in Ohio in particular and Virginia are starting to see an uptick. And so as we look at over particularly the last 7 days, we're starting to see more hospitalizations, more calls come in for transfers, and starting to put more and more stress on the global healthcare system, not simply Secours Mercy Health.
Now, how do you, what are your sort of greatest needs and challenges right now? I mean, obviously earlier in the pandemic, supplies were a big issue. Right now, it seems like staffing is a major issue. So can you talk about where those things rank in terms of what are the hardest problems to solve on a day-to-day basis right now while this is going on?
Sure. So supply availability is in really good shape right now as it relates to PPE, which early in the pandemic was a big issue. We're starting to see some stress on testing availability, particularly with this variant and the sensitivity of some of the acute instant tests. So we're working through that. But more importantly for everyone, it's staffing, right? So we continue to run full service healthcare operations, both acute and ambulatory, throughout the last 6 months as we went through the 3rd surge and we head into the 4th surge. We still have a lot of that same business, as well as now the surge coming on top of us. And so, balancing staff and balancing resources is a daily occurrence now as we work not only in the communities we serve with other health partners, but also within our own system.
Have you been forced at any of your hospitals to scale back on normal operations because of the volume of COVID patients or staffing shortages?
Yeah, so at this point in time, we've not had to face that. It's certainly something, all of us have learned a great lesson over the last year about business continuity and the necessity of being prepared. So we've obviously run some tabletop exercises about what that might look like, what those triggers are within our markets. But at this point in time, we've been fortunate enough that we haven't had to implement any of those. Again, we're not operating in Florida or Texas per se, where we're seeing, really the epicenter of this surge right now. But we certainly are wary and have plans in place if we need to react.
Now, in terms of staffing, pretty much everybody in the business is having the same problems. And I'm sure it varies geographically for a lot of obvious reasons too. Some endemic and some related to the pandemic. But what are you finding, if anything, is effective at retaining the critical staff that you have, and also bringing in people either for short terms or to fill staff vacancies?
So I would say flexibility. This is 18 months in, and we talk about this a lot, among our team and with our caregivers. You get tired legs, right? You can't run a marathon every day. And so really trying to make sure we're cycling in and out and looking for creative ways to staff. Over the last 90 days, we've had a huge emphasis on hiring and had a really intentional hiring surge to bring more folks in, and now bringing clinical nurse specialists in to help onboard those. We've seen across the industry, first-year turnover has been quite high. Think about a nurse that graduated last spring who immediately walked into this, who had their clinicals disrupted, have been working in universal precautions and PPE gear now for the entirety of their nursing career. It's a big challenge. And so we've had to change the way, not only at Secours Mercy Health, but across the industry, and talking to my colleagues about how we onboard folks, and so that they have the best opportunity to succeed, and so that we give them the best opportunity to be connected and feel good, competent, and capable about the work they're delivering.
I've become very hesitant over the last year and change to look too far in the future. But I still, there's something I've been wondering about the entire time. With there's issues about burnout, and not just the regular kind, of course, but there's the daily trauma that frontline workers are dealing with inside and outside the hospitals. If you think ahead to a time when we're not in the middle of a constant crisis, what do you think can be done to address that the lingering effects of that trauma that may make people want to leave the profession or find easier work within it, where they're not in emergency departments or ICUs or what have you, and that might discourage people from going to nursing school, from going to medical school, or getting other kinds of hospital jobs. What's that reckoning going to look like, do you think?
Great question. And I had a chance to sit with 13 of my colleagues across the state of Ohio last week, and this was a topic of conversation over a course of a long afternoon. I think it has to change, right? I think it starts with the care model, and if we think back the last year and a half, you've seen this explosion in the adoption of technology that already existed around virtual care and video visits. And so in our system, as an example, we've done over 900,000 video visits, virtual visits, and e-visits over the last 12 months. That's going to continue. But as we get into the acute care space, we really have to harness the potential of automation. We really have to look at using big data to help drive and help us shape our response to this, and really look at opportunities for patients to continue to receive care in hospital at home type environments, different than our home health of today, and really look at how we become more effective. And I think also we've got to bring other team members back into, the environment. And we talk a lot about how do you bring social work and community social determinants and needs to the bedside. At the same time, you deal with the current social needs that an individual has that resides in that population. So I think there's a lot of that work that has to occur. And I think that leaning into our, some of our other first responders, paramedics, there are a lot of companies out there doing some really creative, unique things to help load balance. So I think there's a lot to come, but we're always going to have a need for allied health professionals, nurses, critical care nurses, and we have to find a way to make the job more fulfilling and not look at it. And we have to harness technology. And I think we've proven we can do that in the virtual world, but now we have to really look at how we change the way we deliver care moving forward. And we've been very creative as an industry and at Bon Secours Mercy Health, the things that people have done. It's been, mind-boggling. And when I get a chance to go out and round in the field and talk to our staff and hear some of these things, I mean, it's just amazing, the creativity. We have to harness that same creativity going forward.
And I'd like to actually ask you in a moment about one piece of what you just mentioned, which is data and about your company's sort of push into data and analytics. Before I do want to ask one other question about the current state of COVID, and that is, as you know, a growing number of employers have imposed vaccine mandates or something similar to them, including a lot of healthcare companies. And to date, you guys have chosen not to do that. So I wanted to ask, what other strategies have you found work at persuading employees who might be reluctant to get vaccinated, especially those who are, patient-facing?
Appreciate the question. It's a question I get often from our community and volunteer boards. I mean, the first step in this is listening. I mean, we have to not just get so polarized that we take one side or another. We have to be able to understand both sides and figure out what the best option and opportunities are, because there are legitimate questions. We firmly believe in vaccines. We strongly encourage our staff members to be vaccinated. And that being said, we've looked at community situations and local markets to see how we can best lean in. We've seen our vaccination rate slowly climb. But also, we want to understand why. And so, we're investing significant time into going out and asking and listening and trying to understand if there's things that we can do differently, whether it's messaging, whether it's opportunities to understand, to ask different questions. So, we fully appreciate both sides of this issue, and we just don't think it's binary, that it's yes or no. We think that we have to have discernment, and and that's the approach that we've taken, and I trust that as we go through this, we'll continue to let the science lead, but we don't think it's a binary response.
And actually, can I ask just to follow up on that? Are you seeing any differences, at individual hospitals or in certain states or parts of states where the take-up rate of the vaccine is higher or lower, or is it similar across the board?
No, it's different across the board. So we'll have areas that we have very, very high uptake that is very similar to the community. And I'll be honest, in most communities, our vaccine uptake kind of mirrors the community. Mm-hmm. So we don't have big deltas that say, you know, the healthcare workers are this low and the community is this high, or vice versa. Typically, we measure and monitor and track against the community itself. So, you know, as you look in some parts of the country where we operate, we have slower uptake than some of our bigger metro areas. And candidly, in Ireland, 97% of our staff are vaccinated. And they're trending very high on their community population side. So we're seeing the same trends everyone else is.
So now I want to move on to what I mentioned before and dig a little deeper on your company's focus on data and analytics right now. And just to catch people up who might not know, this year not only did you participate in the co-founding of Truveta, but also you made an investment in Trillion Health. Just in sort of 30,000 foot way, why? Let me rephrase that. How do you see that the use of that kind of data and analytics tools shaping the way that you operate in the future, not just inside your own buildings, but in a bigger sense, you know, how that could transform healthcare across the board?
So we've been interested in this work for over the last 5 years, and we've had a variety of partnerships and working with different folks. We believe that data analytics can make healthcare easier because we can help understand the trends within specific business lines or service lines, as well as in specific disease states. We also have been using predictive modeling in the industry for some time to predict, you know, vulnerability to sepsis, vulnerability to readmission, and those tools are excellent. And we'd like to see that then take that to the next level. You know, if we can marry up a person's shopping habits and exercise habits, you know, with their consumption habits along with their health state, and allow them to have that data, and we can make healthcare easier to make the right default choices, we think that's huge. We think that could be a potential game changer. And as the data availability continues to change, you know, we're very excited about our partnership with our 12 other colleagues in Truveta, and we think there's some big insights that will come for that we can go and use to help improve the health of these communities that we serve. Because at the end of the day, that's what we're here to do is to help those communities improve their health. And we think this is a tool that has been underutilized to date, and we think there's high potential and high promise.
Well, we're nearing the end of the time we had today, but I do want to try and squeeze in one last question. I'll keep it brief. You know, again, just to catch people up who might not be paying as close attention. Last year, you hired Odessa Stapleton as your diversity and inclusion officer, and I believe that was a new position. Can you sort of talk about what the overall goals are of creating that role and how it fits into the company's plans for the future?
Sure. Odessa is great to work with. She's been a great resource for the organization and has really helped take this work that we've been doing for the last decade to a different level, and really take it into the local market level from more of a system approach down into market-based councils, and to really have, you know, one of the biggest programs we have is a program called Differences Dialogue, so that we're getting people around the table, you know, that we can really share. Much like I said earlier, we're very big on listening. We think that, you know, we have to understand what's happening. And Differences Dialogue program is one example in the markets has really helped us see things through different lenses, whether it's a health equity lens, whether it's an access lens. The other thing is that we hold ourselves to a very high standard in making sure that our boards and our executive teams, you know, mirror the communities we serve. And so, you know, with our board holds us accountable to that work, and we continue to lean into that work. And we think that's very, very important. And then finally, you know, we participate with some other institutions in the Healthcare Anchor Network, and Odessa and Gene Haynes, our pop health and community health leader, both participate and are driving force around how do we create place-based investments that change areas with high health disparities through job creation and through other economic incentives to really address these issues. So we're very excited about it. It's a big part of everything that we do. It's part of our board meetings every time we meet. It's part of our management team meetings. It's part of our local DNA and how we work together. So, you know, we care for everyone in the community, you know, so we need to understand different perspectives.
Well, I'm going to close out now. Thank you very much, Mr. Smith, for your time. It's been a pleasure talking with you. And I hope that you and everybody is safe and gets through this thing.
Thank you, Jeffrey. I appreciate the time today.
Thank you very much for watching The Checkup. I've been Jeffrey Young, News Enterprise Editor. We will see you next time.